When I can't speak, when I feel locked in, when my whole body just shuts down. It comes in two waves. My nervous system, it just calms it down.
Cannabis has long been a common and accepted medicine in Israel. About 129,000 Israelis use it with a prescription. Among them, Oriel, who has been using it for more than a decade to ease the pain of his illness.
Whatever is constricted, it simply releases it. And of course, whatever's painful, it stops it.
But a new study conducted in the U.S. is raising concerns that cannabis may actually be dangerous. Those who consume it have a 6-time higher risk of suffering a heart attack compared to those who don't.
In 2010, I discovered that I had multiple sclerosis. I started due to the spasticity and a lot of pain, problems eating and sleeping. I started taking medical cannabis. It helped me with eating, with sleeping, and with the spasticity. It helped me function like a normal person.
The study also states that regular cannabis use quadruples the risk of having a fatal stroke and doubles the risk of heart failure. This is a fundamental study that followed around 4.5 million patients for 3 years. What's even more worrying is that the risks of cannabis in patients under age 50, an age group that is usually at low risk of heart problems.
We're seeing more and more people, both young and old, using cannabis, also for the purpose actually of pleasure. But it also has many medicinal uses. And actually, this is an article that talks about this connection between smoking cannabis or using cannabis and cardiovascular disease. When on the one hand, we know that cannabis has medical potential to relieve pain and for helping with various health conditions. But on the other hand, we also know that it can cause significant damage to the heart and blood vessels.
Cannabis in Israel is only available following a medical diagnosis and is provided through a medical prescription.
It's very individual between people. Some people need cannabis because it's like air, and without it they'll die. I'd rather have cannabis than the worst things. And there are some hard medicines that are more dangerous than cannabis.
The study is actually trying to show the positive sides of cannabis as well. It talks a lot about the mechanisms and the receptors and the processes through which cannabis works. And it actually offers the option that by better understanding how cannabis works and how it affects people, we might be able to develop drugs using it in the future. That means it also offers a lot of research possibilities for the future.
The analysis of this study's findings is still in its early stages, but it casts a shadow over the use of cannabis as a popular medicine and threatens the medical marijuana industry, a hugely profitable business.